Your local news leader. This is WCIA 3 News at 10.
I just feel like they took advantage of us.
The network of doctors for a number of state retirees in Champaign County shrunk a second time this year. Good evening, I'm McLeod Hageman. Fewer than 3 months ago, Carle Foundation Hospital severed its ties with Aetna Medicare. Aetna is now dropping several Christie Clinic providers out of its network because of their relationship with Carle. Target 3 investigative reporter Renee Cooper has been talking to patients who aren't quite sure where to turn next.
When it was open enrollment time, nobody said, oh, by the way, we're going to be dropping a lot of doctors out of network.
Vicki Good is a retired Central Illinois teacher. When she moved to Champaign, she signed up for Aetna's Advantage Plan, one of 2 health insurance options for state retirees enrolled in Medicare in the county. Good's primary care doctor is at Christie Clinic. That is, until May 1st, when her insurance will no longer cover the cost. She was first notified in a letter dated March 1st.
I called the number of this Dr. Bartlett, which was on the letter. They said, here is a doctor that we are saying that you can use. And I said, is he accepting new patients? And she said, no. And she says, not only that, he's going to be out of the network as of May 1st.
It all started right here last year. Carle Foundation Hospital terminated its contract with Aetna Medicare effective January 1. Now, the impact is spilling over for Christie Clinic patients.
I really feel like I don't know what to do about health care.
The clinic's chief financial officer says fewer than 17 of its 179 primary care doctors and specialists will be kicked out of network. It's an estimate of how many providers have been notified so far by Aetna because of their affiliation with Carle Hospital.
All they can do is admit at Carle.
The State Department of Central Management Services controls Medicare plans for state retirees. The deputy director says physicians were given the opportunity and time to get admitting privileges at other hospitals. Quote, the physicians that are no longer in the network did not exercise this opportunity.
I think a rough number is around 11%.
That's the number of Aetna Medicare patients over at OSF. The director of physicians says they've started to see an influx of new patients since January.
For everything that you guys have been called for, are those all specialists you have and all taking new patients? Yep. So far, we haven't been able to, not provide the service that they've asked us to provide.
For now, Vicki Good is waiting to see if a renegotiation is in the cards.
And I just refuse to go through their whole directory, calling doctor after doctor after doctor, trying to find out who really is going to be a provider in network. Their bottom line is they want to make a profit for their company, but it just seems like they are taking more and more choices away from us.
Christie Clinic's chief financial officer says they're working on additional hospital relationships that would be in network for Aetna patients. We have more details about this story online, including full statements from the clinic and Carle Hospital. We have not received a response to questions from Aetna as of this report.